Excited to invite, I think, a frontline healthcare professional that can make a massive difference in the community. If you think of those third spaces in our communities, like libraries, what's another one? I think local shopping centres perform that role too, incredibly. I live near a massive shopping centre and I just marvel at it whenever I go. I'm not a massive fan of shopping centres, but what I love about it is that it's this great swell of humanity gather there. And another place I think is the local pharmacy, very much is another one of those third spaces, and they are really important. People feel really safe sometimes going to a pharmacist. I think just that's a vital industry. So now joining us then, Q, the Pharmacy Guild of Australia, to consider the important role of pharmacists and how they can play a role in the Equally Well movement. Kirsty Brown has been a community pharmacist for 13 years, working in South Australia, both regionally and in the metro area, as well as 2 years in the fabulous Alice Springs. She is a regional pharmacist manager at the Scafidi Group, a privately owned and managed group of pharmacies, and manages pharmacies and dispensary teams in Queensland, South Australia and the Northern Territory, supports teams to deliver high quality services to the community. Please give it up for Kirsty Brown.
Thank you so much. It's great to be here today. I've been really inspired by the talks given so far. It's been excellent, so I won't take up too much of your time. I know lunch is not far away. So I'm just here today to discuss how pharmacists working in our community pharmacies across Australia are now able to practice at a more full scope, and how they this can provide an enhanced, accessible healthcare service for people with mental health issues and to help better manage their physical health. So the statistics, as we've heard this morning, are alarming. People with mental health issues are dying prematurely from most preventable and manageable diseases. Many of these people are regular visitors to our community pharmacies every day, especially if they are regularly accessing their medications. We'll see them, once a month, if they're on a once monthly medication. Some of your opioid dependent treatment patients we will see every single day. Thank you for the lovely welcome. I don't need to address myself any further than that, but I guess the only thing to add is I have done the enhanced full scope of practice training in Queensland through JCU and QUT, and we have started doing some of these consulting services. When I'm up in Queensland, it's rolling out through the other states, kind of one by one. Clicker. Okay, so people ask, what am I talking about? What is pharmacist full scope? And I think the main message I want to say today is that pharmacists working at their full scope of practice is not quite ever complete. It's a continuous evolution of what pharmacists can do for our community patients. In addition to dispensing of medicines and provision of health advice, pharmacists do more in the areas of preventative care, medication management, and prescribing for a spectrum of acute, common, and chronic conditions. There's a really interesting study project that was done in 2020. So whilst mental health diagnosis and treatment is not in the scope of a pharmacist's practice, it is interesting to note this research project, which demonstrated the effectiveness of pharmacist interventions under the Pharm-I Bridge service. It provided significant physical health outcomes to people who were diagnosed with persistent and severe mental health conditions. So there were 51 pharmacies and 326 patients that took part in this trial over a 6-month period. So in the project, pharmacists work with people living with severe and persistent mental health conditions, such as schizophrenia and bipolar disorder, over 6 months to review medicines and health concerns. By working with each person, problems with physical and mental well-being, lifestyle, nutrition, and other health-related issues were identified, goals were set, and strategies were discussed to try and address these health and lifestyle concerns. What the project demonstrated was that community pharmacists providing a person-centred, flexible and goal-oriented support service significantly reduced psychological distress and improved the quality of life for people living with mental health conditions. Additionally, people used their medicines to better manage their long-term physical health conditions, such as diabetes and blood pressure. The service was found to be good value for money, demonstrating that trained community pharmacists can play an important role in improving the mental health and overall well-being of people in this scope. The project's success is significant, particularly given that it occurred during the very challenging COVID-19 pandemic. And I think we can all agree it was community pharmacies were the one health service that could not shut down at all. We could not work from home. We were there every day. We had our masks, we had our screens, and we were there serving our patients. We were delivering medications to their home and still trying to provide vaccinations and services in a safe manner. More broadly, the project highlighted the role and support community pharmacists could have in helping people. Both consumers and the pharmacists valued being involved in the service. Consumers appreciated being seen and heard by pharmacists and supported to work towards health and wellbeing related goals. Pharmacists had increased awareness of consumers and the story behind the script. It helps them gain greater confidence in supporting people living with mental health conditions. The patients who completed the project indicated that the service was well liked, with many reporting positive experiences. Participants liked being able to think about their health more broadly and work on a range of issues with support from their pharmacists. Some people had not previously spoken to healthcare providers about these issues, especially in rural areas with fewer alternative health supports or services available. Setting goals was really essential in providing structure and motivation to help people achieve or work towards positive outcomes. Consumer participants described a sense of achievement due to health behaviour changes and resulting positive effects. If anyone is interested in reading a bit more about this study and project, just come and see me. I can send it out to you. So, back to full scope of practice for pharmacists, which you may have seen a little bit in the media, particularly in South Australia just recently. There was a big announcement from the SA government. The 22 conditions referred to under a pharmacist's full scope of practice are aligned with conditions which are those likely to be potentially preventable hospitalisations if diagnosis and treatment, including referral, are delayed. We know people with mental health conditions typically present with other health comorbidities. Under full scope, pharmacies can provide services to help with diagnosis, treatment and referral. Cardiovascular disease underscored by hypertension and dyslipidemia can be routinely screened with lifestyle and pharmacological interventions provided. When a consultation is undertaken, physical and social factors are included as part of the pharmacy interview with the patients. And pharmacists, like other healthcare professionals, have become aware of social prescribing, and in conjunction with protocol-based prescribing, it's all a part of the holistic care. Many pharmacists play an important role in providing care for vulnerable patient groups already. It can be the one health service that they actually have contact with on a monthly basis if they're taking the prescribed medications, and it may help capture those who may otherwise slip through established services. Treatment for opioid replacement therapy can see patients build a long-term trusted relationship with their pharmacist. Pharmacists are well placed to encourage vulnerable patient groups to consider vaccinations, especially for seasonal influenza, which I know Russell spoke about earlier. There's this huge bridge that we are not seemingly able to bridge at the moment. During Russell's talk, I looked it up, and under the National Immunisation Program, the annual influenza vaccine is funded for those over 65 and for those with other medical conditions. Let me just read you some of these other medical conditions. Cardiac disease, chronic respiratory conditions, chronic neurological conditions that increase the risk of respiratory infection, immunocompromised people, diabetes, renal. I noticed what was not on there. Not one mental health condition. So anyone under the age of 65 is not eligible for a free influenza vaccine from the national government. Having said that, states like Queensland do provide free flu vaccinations for all residents, but they are one of the only states that do so. Sorry, I got distracted. Yes, okay. So pharmacist scope of practice provides this opportunity through established treatment guidelines to provide follow-up to free support services as well to help coordinate care. Through referral pathways to GPs, further screening opportunities can be identified to national programs such as the National Lung Cancer Screening Program, Diabetes Australia, the Lung Foundation, Asthma Australia, Heart Foundation, Stroke Foundation. These all have excellent resources available for healthcare practitioners and patients. Pharmacists can help with triaging of telehealth options. Scope of practice has evolved pharmacy environments which now include dedicated private clinic rooms with tech enablement for video telehealth options with GPs. Local community pharmacies are connecting with their local GP clinics and other allied health professionals to refer people straight there if there is a major concern with a patient that presents to them, or it goes to an area that is beyond our scope. It also maintains continuity of care, and pharmacists are required to provide consultation notes to patients' regular GPs or the GP surgery via secure messaging. So this is a bit of a look at scope across the nation, which I must say is different in every single state. So the 22 conditions under scope of practice are attributed to those recognised as conditions which make up the bulk of hospitalisations and could be avoided with earlier intervention and treatment. Annually, conditions such as pneumonia, which a pharmacist cannot treat or diagnose, but we can contribute to patients with asthma and COPD and help them with their management plans to avoid getting to the stage of pneumonia. UTIs and cellulitis, which again is not something we can treat at a pharmacy level, but we can provide acute wound care, which may stop us from getting to that point of cellulitis. These make up the bulk of hospital presentations in Australia. So it's great to see that all states are now on board with enabling pharmacists to practice at full scope. Over time, we're hoping to see harmonisation of services across the nation. It means that Australians will be able to seek treatment for many common health conditions at their local pharmacy. At this point in time, all states can now deliver vaccinations under the National Immunisation Program, treatment of uncomplicated UTIs, and the administration of long-acting ibuprofen. Queensland is the most advanced state, with over 400 pharmacists now able to practice across local communities. The Northern Territory should be starting early next year. Their cohort of pharmacists is just completing their training. South Australia is beginning training in January. Victoria and New South Wales are rolling it out a little differently. They're introducing conditions 1 to 2 at a time with appropriate training. It's a complicated slide. The conditions are listed on the side and what you can and can't get in different states across Australia. So we have a growing and an ageing population with increasing chronic conditions. The demand for hospitals is increasing, as is its access to GPs. Shortages in healthcare is felt in regional, rural and remote areas. The Guild's vision is that by 2035, 80% of community pharmacies are delivering full scope of practice services, and 80% of community pharmacists will hold requisite qualifications to prescribe. The independent research by the Guild shows benefits across our healthcare and social systems and savings in healthcare budgets, increasing productivity and freeing up emergency departments and GPs. Our network of over 6,000 community pharmacies dispersed across Australia with some 36,000 AHPRA registered pharmacists are ideally positioned to enhance healthcare delivery in Australia. We look forward to providing care where patients need it, using our skills and experience aligned to our scope of practice, clinical and regulatory guidelines. Thank you so much. I just wanted to give everyone, a bit of an idea of what we at community pharmacies are doing and what level we're at the moment. There's a lot of work to be done, there's a lot of training to be done, but there are things that we can do right now, such as vaccinations. And you know what? We're there for a chat any day. We see these patients regularly, all the time, and it's a privilege. So thank you so much.
Amazing.
Oh, wait. Sorry, I have one more thing. Oh, yes, thanks. So we're out on the right there. We're providing free health
checks. What does that mean? Tell us what you're doing. Just so that
we are providing blood pressure checks, random blood glucose. We're hoping we're getting our cholesterol machine. It's not there at the moment, and we can send that report straight to you. It's just a screening. We're not diagnosing anyone out there today. We're just letting you know your level of risk.
But just the power of that process, though, what can it be a portal into? Having a free health check?
Oh, yeah, so it just, some people are not, I don't know, some people in here may not have had a blood pressure check. Like, when was the last time you had your blood pressure checked? It can just be a very simple health check that can, it may highlight a small risk that you're experiencing, and we can just get on the journey to some further health care.
So we've got the Farmer Bridge project leader in the audience, Amanda Wheeler. Where are you?
I didn't know that.
Love this. The speed dating continues today. What a fine thing. I'm just going to come to you while we've got a couple of minutes before lunch. If you want to add anything or reflect on anything about Farmer Bridge.
Thank you. And I need to introduce Vicky Stewart, who was actually the PhD student with us, and she did all the work for the interviews and the work with the consumers and the pharmacists afterwards. Look, it was a fantastic experience. I think everyone, the rural and remote services, really, the communities there, this I think is really where it excelled. The communities were able to access services when they needed it. These pharmacists became known in their communities as mental health friendly pharmacies. The story behind the script video, which is actually on the website, is really nice. It was, pharmacists saying they were really worried about asking questions of people. Those were people they came into their businesses frequently, but they never really ever talked to someone. So a lot of this was just about communication, getting to know people, trust relationships, and then being able to solve problems over time. And so the same for the consumers who were going in. They also said they were scared of asking questions. So it was really, a lot of this is about communication. So, and I think the thing that I would also sort of, if you've got time to talk about it, was just about access to meds check, and for people to understand that you can, if you are on a number of medicines, it could just be a new one that's added into your medicine regime, you don't know much about it, you want to actually understand it a bit better, go into your pharmacy and you can have an in-house medication review done with the pharmacist. It's, you can have it done every 12 months and it's funded and it's available. You can have it done if you're a carer and you want to involve someone else with it. So if you want to talk about that, I think that's one of the free services that people don't know about.
Yeah.
Do you want to add anything? No? Okay. Congratulations on the PhD. Have you finished? Oh, hero.
I can quickly talk to meds checks. They're free service available, should be available in every single community pharmacy. So the eligibility criteria is, I think, 5 or more medications at high-risk medications and newly diagnosed anything. So I feel like it pretty much means that everybody's eligible for a free meds check. It can take anywhere from 5 to 20 minutes. You sit down with the pharmacist. We make sure you know what you are taking your medication for, if you're experiencing any side effects and you're having any concerns.
We have a question here. I'll hold the mic.
Thank you. I'm just wondering, is there a cost to people when they come for the Farmer Bridge project?
The girls in the back probably can talk more to that.
Yell it out. Is there a cost? Unfortunately. Yes, hang on. It's more complicated. There's a caveat. I've got it.
So unfortunately, Farmer Bridge as a trial, despite showing a lot of significant benefits, one of the main primary outcomes was improvement in medicines adherence. That was what the government was interested in, and the significant difference between the control group and the intervention group was not at the level that the government wanted to see, so it hasn't been funded by Medicare.
So how much does it cost?
So it's not available currently. It hasn't been rolled out as a service, but the pharmacists who were involved in that trial are still working at the same kind of level. And since then, other parts have been put in place at lots of the pharmacies, and the Pharmaceutical Society of Australia as well is putting a lot of these services in. And this is where a lot of the expanded scope of practice has come from, is work like this, but it's being rolled out and put in differently.
Useful information. Thank you so much. Russell Roberts, hello, has said, what's so great is community pharmacies are so welcoming and easy to access, such a valuable connection point. Linda May, with the increased number of interventions available by pharmacists under the FSOP program, this will put increasing pressure on busy community pharmacists. How will this be funded and resourced? Are the interventions fee for service?
It is fee for service, and it's currently patient funded. There's no government funding.
How much?
In Queensland, it varies on the length of consultations. So there's short, medium, long consultations, and it would range. I think the short one is around $30.
Okay.
Up to about $60 for a long one. So we do realise that is a barrier.
It's a barrier.
We are trying to upskill our pharmacy teams to help free up the pharmacists more to have more time to do these things, though.
Fantastic. One final question. Have we got it? Yes. I'm going to give you the mic while I get something.
Well, I was just wondering if NDIS could fund.
That's a great question. It's something that we should have a look at. Yeah, absolutely. Because, as I said, it's completely patient funded, and also anything that we prescribe is non-PBS. So another barrier.
Kirsty Brown, thank you for the work you're doing, and thank you for being here.
Thank you.
Kirsty Brown, I've got a little prezi for you.